Hi, my name's Keziah Gibbons, and I'm pleased to welcome you to this course on pain management. In a moment, I'll talk you through the scope of the course itself and the pain management model. I first came to work with this model several years ago as part of my training in neuro-linguistic programming, and I have successfully applied it myself. I live with pain, injury, and illness, so I do understand that the quest for relief can be a long one, and that pain is a complex problem that can affect all areas of your life. This course is not a quick fix, but it will give you some tools to make changes and experience relief which may improve your quality of life. Before we go any further, I would like to stress the importance of seeking accurate diagnosis whenever you experience pain. This course must not be used without understanding the cause of your pain. This is because pain is often the body's way of alerting you to an issue that needs to be fixed. We will talk about this more in a moment, but for now, please do see an appropriate clinician to help to diagnose and treat your pain. This course is a supplement to appropriate medical treatment, and not a replacement for it. And there we have it, the main idea that underpins this pain management model. All pain starts out as a message to alert us to something wrong. If you were to put your hand in a fire, it would immediately hurt. The purpose of this pain is to tell you to take your hand out of the fire, and this would likely happen without any conscious effort. If you had burnt your hand, you would continue to have pain signals, which would likely feel different to the pain signals that you'd had when your hand was in the fire. This would be your body alerting you to the injury and reminding you to seek treatment, and to take extra care with your hand, and avoid touching things which could cause further damage or infection. This is the message of the pain. The first step for you then in following this pain management model is to discover what your pain is telling you. Does it change depending on what you're doing? Again, when discovering the cause of pain, it is wise to seek the counsel of a medical professional who may be able to rule certain causes out or in. It is fundamental to this approach that you discover the cause of the pain before proceeding, so that you can make any changes necessary to address the cause and not just the symptom. In the meantime, when you get to the practice section of this model, you will be working with your unconscious mind to ask your body to communicate with you in a more comfortable way. The most common messages that pain communicates are to stop something that's causing damage, to seek something that your body needs, or to alert you to illness or injury in the body which needs to be addressed. Let me share with you an example from my own personal experience. I have a serious knee injury and am missing several vital components of the structure of the knee, and as a result, other structural components are in the wrong place. When I attempt to stand or walk on the knee, I get immediate pain that's associated with weight bearing. This is because putting weight on my knees causes the bones to rub against each other, causing further long-term damage, as well as irritation and inflammation in the short term. When I take my weight off the leg or sit down, the pain stops. Much like the example with the hand in the fire, my body uses pain to alert me to damage. So the pain is communicating to me the limits of my physical ability. Yes, this is, of course, frustrating, but ultimately, my body is trying to protect me. And until I access a treatment that repairs the structure of my knee, the pain is useful. However, I no longer experience knee pain when sitting, lying, or even cycling, because those activities are not causing stress or damage on the knee. So the first part of our pain management model is to learn to listen to the pain and make the changes you need. This can be the most challenging part of the model, both psychologically and practically. So do go easy on yourself and ask your support network to help you. But it is absolutely fundamental to ending your pain. The man who made his living loading vans didn't like having to sacrifice a regular income to end his back pain. The woman with severe endometriosis didn't like having to take time off to rest during her menstrual cycle. And I didn't like giving up the walking, hiking, and dancing that I used to love. But we all had to do it because these behaviours were exacerbating the pain. I stress this because it's important, but again, I acknowledge that this is not always simple, and that once you identify anything that's causing you pain or making it worse, you may need some help and some time to make any changes you need to. Be patient with yourself and ask for support where you need it. The next part of our model is to reframe the pain, and from now on, we will no longer be using the P word, but instead we'll be describing our experience of these messages from our body as aversive sensations. The reason for this is that the language we use has a huge impact on how we experience reality. Your unconscious mind is always listening, and it takes the words we use to construct your experience. So when it hears the P word, it interprets those sensations in a particular way. But when you begin to understand at the unconscious as well as the conscious level that this is only an interpretation of a sensation, which is in itself not only a neutral experience, but also a useful experience, because these sensations are messengers, then the sensations become easier to bear and may quieten down or disappear altogether, especially where the issue that the sensations have been alerting you to is being addressed. Finally, the practices in this course can also be used for leftover aversive sensations. This is what happens when the message is still being sent, long after the cause of the sensations has been resolved. This can be observed in some chronic aversive sensation experiences. And what you will find is that as long as the cause of your aversive sensations has been addressed, these practices are really helpful in ceasing the sensations that have served their purpose. There are two practices in this course. The first is a long-term daily practice, which works with the unconscious mind. You should use this practice once or twice a day, ideally first thing in the morning and last thing at night, to take advantage of the natural trance-like states that occur in the times immediately before and after sleep. This practice will ask you to connect with and direct your unconscious mind, but if your conscious mind drifts during the process, and even if you do fall asleep while listening, don't worry. Your unconscious mind always has your best interests at heart and works best when not being observed by the conscious mind. I will emphasize here, because this is a common question that has arisen in my years of teaching, that if you're not consciously aware of a trance-like experience, or if you happen to hear questions or instructions in the guided practice that you don't know how to answer or follow, this is a good sign. This means that your unconscious mind is working independently, and in this practice you can just allow yourself to drift. Your unconscious will keep you safe. The second practice is for use in the moment for immediate symptom relief anytime you experience aversive sensations. It uses a mix of mindfulness, breathwork, and relaxation to help you to instruct your body to release the aversive sensations. In the moment when aversive sensations happen, there are 2 points where we can intervene. The first is the transmission of the sensation itself, and it is at this point that a lot of painkillers work, by blocking the sensation before it gets to your brain. The second point is in the moment at which your brain receives a signal and interprets it, sending that interpretation to your awareness. The in-the-moment practice helps your mind to find a softer, gentler, and more comfortable interpretation, sending the message back via the brain that you can relax and you may even let go of any aversive sensations. You can just use this practice whenever you need it and repeat it as many times as you need. Thank you for trusting me to be part of your healing journey. I wish you much peace and ease.